What is a DIEP or DIEP breast reconstruction? Well, in this video, I'm going to be explaining all. So you have been recommended to have a mastectomy as part of your breast cancer treatment. You have options. You can either go flat and not have a reconstruction at all, or you may want to consider to have a reconstruction either in the immediate setting at the same time as the breast cancer operation or in the delayed setting. The options are either using an implant or using your own body tissue. So what is a DIEP reconstruction? Well, this essentially uses the fat of your tummy as well as the skin to make you a new breast. It is detached from your person and then reattached to the blood vessels on your chest wall or your armpit to make you a new breast. DIEP or DIEP stands for Deep Inferior Epigastric Perforator, which are essentially the blood vessels that supply that particular flap. So who is a DIEP reconstruction suitable for? Well, of course, this could be your particular preference. You do not want to have an implant and you want to use your own body tissue. But there are certain considerations. First of all, you need to have enough tissue in your tummy to enable us to make you a new breast. So if you have enough, then that's fine. But if you're quite slim, then potentially we won't be able to use that particular flap to make you a new breast. And of course, this depends on the size of your breast to begin with. Although your preference may be to have a DIEP reconstruction, there are other considerations that we have to take into account. And these are your body mass index or your BMI. If your BMI is too high, a DIEP reconstruction can be too risky and this could be a contraindication. If you're a smoker, again, this can increase the risks of complications and wound delay problems. And again, this may be a contraindication. And lastly, there may be other comorbidities that again may be too risky for a DIEP reconstruction. These discussions will be had between yourself and the plastic surgeon, who can then decide whether a DIEP reconstruction is suitable for you. The other thing is, if you've had abdominal surgeries, it may cause some challenges, although not necessarily, because what will happen is you'll get a CT scan, and the CT scan will actually look at the blood supply to that particular flap, and if these blood vessels are viable, then even if you've had abdominal surgery, doing a DIEP reconstruction is always a potential possibility. So how does the surgery work? It actually happens as a joint case between your breast surgeon as well as the plastic surgeon. The reason is we need to utilize expertise from two different surgeons. The breast cancer surgeon will perform the mastectomy, whilst the plastic surgeon will harvest the flap, the DIEP flap, and then make a new breast for you by performing microsurgery. By having two surgeons, that minimizes the general anesthetic risk and the time of the general anesthetic as well. How about the scars? Well, you'll actually have two scars. You'll have one scar on the breast, and the second scar will be along the lower part of your tummy. It's akin to a cesarean scar, but much longer, and it goes from one end to the other. Recovery time can take slightly longer. You will stay in hospital for anything up to 4 nights, and when you get home, you may feel a little bit sore. We will, of course, supply you with a lot of analgesia to make sure that you are not uncomfortable at home, but to make a full recovery can take a few months. Many women choose to have a DIEP reconstruction for a number of reasons, and mostly because it feels the most natural. It is your own body tissue, so it will feel soft, unlike an implant, which can feel a little bit firm. And, especially if you're lying on your front, you will actually feel like there's something just underneath the skin. A DIEP reconstruction, on the other hand, feels much softer. And unlike an implant reconstruction, a DIEP reconstruction does not need maintenance surgery. So once it's done, you can forget about it. A DIEP reconstruction, however, is a big undertaking. And so it's something that you have to discuss with your plastic surgeon very carefully. There are many considerations that we take into account, not least whether you need any further treatment following surgery, but also all the other factors that I've described beforehand. It's an important decision to make, and you have to make sure that all the risks and potential complications have been discussed. I hope this has been helpful, and leave any questions in the comment section.